broaden that out a little bit to look at some of the other elements of treatment that happen in Domus. What kinds of things would people find themselves doing throughout those days that they're there?
Well, the first part is, I think, just really coming back to themselves. People take opioids because life is too much. There's too much going on. And a lot of other places either don't give enough, or they just load you up with, session after session after session. So, we're really put together to try to find a good balance to that, where they can have time to themselves. There's some intensive psychotherapy where we get down to some of the deeper issues as they feel up to it and ready. And in terms of what a treatment is, in essence, it's understanding what needs the person is having that are not getting met well. So if your need is to sleep, okay, well, we have to figure out what that is. If you are pushing yourself at work and your life, maybe you have a really good life. We see people who have really developed lives. They're pushing themselves so much at work that there's a discrepancy between their outside life, which is going very well, and how they feel internally. So the opioid is taken often to fill that gap. So I feel better, at least temporarily. And then now you're into a cycle that doesn't work. But so you look for what are the needs that aren't being dealt with well, or need to be met.
That's one thing I appreciate about the philosophy. A lot of times, I myself as a therapist, a lot of times I'll see people who they feel like immersing themselves into the ins and outs of addiction and even the therapy world, that so much so that people can, like, all they do is they're listening to, obviously, podcasts like this. Obviously, we're in favor of that. Books, obviously, we're in favor of that, right? Therapy, obviously, all these things. But sometimes there's also a need to say, you need to do some other stuff. Don't just immerse yourself 100% in the addiction part, and instead look at the health part. Things like physical exercise, other types of, I don't know, supplemental type of healthy behaviors. And it sounds like that's part of the goal, is to get people on that road as well.
Certainly.
Yeah, I think, Dwight, it's important. I always talked about patients trying to find balance, right? And pills just are not the answer, or drugs to finding balance.
Yeah.
And so you're right. So you need therapy. At Domus, there's massage, there's yoga. I think part of it is just people learning to be comfortable with just being by themselves, not always relying on other things. So we do use some medications at Domus to transition and help to reestablish good sleep, but exercise, nutrition, sleep, therapy, just finding that balance in their lives, because a lot of patients or people just go. And I think that's kind of what, David was referring to as well. The other thing I'd like to mention is that we're not just treating opiates anymore. So if you look at the drug supply, a significant percentage of the patients that show up to be treated are positive for methamphetamine. They're positive for cocaine. We know that there's xylazine, an animal anesthetic, in the medications now.
No.
There's people that are also drinking. So we're not just stopping opiates when we detox them. We're stopping all of these other medications. And while there may not be a specific detox for these their body still is recovering or detoxing from these. So it's another reason why an aftercare like Domus is so important, because they are detoxing from the opiates, which, we've successfully treated that dependence, but their body's got to find a new balance, from not only psychological balance, but now physiologic balance after having all of these substances discontinued. So the aftercare is just so essential.